In this video, we demonstrate bent ab interno needle goniectomy assisted by visco-dilation of the Schlemm's canal, also labeled as Visco-BANG. This procedure may be performed in conjunction with phacoemulsification cataract surgery or as a standalone procedure. It is preferably performed under perivalvular anesthesia, which prevents any inadvertent movement of the patient's eye. For this procedure, you need a microscope with a rotatable head, a Swan-Jacobs gonioprism, a 30 gauge 13 mm needle, a visco-cohesive agent, and a keratome. This animation gives a brief outline of the procedure. To make the goniectomy needle, use a needle holder to bend the tip of the 30 gauge needle at the end of the bevel. The bend should be almost 90 degrees and the bevel should face the surgeon. This needle is then attached to a syringe of visco-cohesive agent and the plunger is pushed to check the flow. Now, the head of the microscope is tilted approximately 30 degrees towards the surgeon and the patient's head is tilted away to reach a point where the coaxial illumination is almost parallel to the iris plane. The goniectomy needle is introduced into the anterior chamber through the main port and visco-cohesive agent is injected to deepen the anterior chamber. Using a viscoelastic material as coupling fluid, the gonioprism is placed on the cornea to visualize the angle structures. The goniectomy needle is engaged in the Schlemm's canal and the plunger is pushed. As the visco-cohesive enters, a slight ballooning of the Schlemm's canal may be seen at this point. Now, the goniectomy needle is advanced in an anti-clockwise manner to de-roof the dilated Schlemm's canal up to 60 degrees. It is important to note that the viscoelastic is continuously injected as the needle is advanced. At the end of the goniectomy, the needle is pulled centripetally to incise the strip of trabecular meshwork. This prevents its future reattachment and failure of the goniectomy. The needle is taken out and the visco-cohesive agent is aspirated with a coaxial IA handpiece. Here is another case demonstrating the technique of Visco-BANG. After identification of the trabecular meshwork, the Visco-BANG can be performed as demonstrated. The goniectomy may be performed using three different approaches. The first approach is mark and meet. The second one is the inside out approach. And the third is the outside in approach. This technique of Visco-BANG has been published in the Journal of Current Glaucoma Practice. The Visco-BANG procedure offers certain advantages over the conventional needle goniectomy. The outer diameter of the 30 gauge needle is appropriate for visco-dilation and goniectomy. The visco-dilation prevents injury to the outer wall of the Schlemm's canal. The injection of visco-cohesive may aid in opening of the collector channels. Visco-cohesive agent helps maintain a deep anterior chamber during the procedure, and it also keeps the surgical field clear. To conclude, Visco-BANG using a 30 gauge proximally bent needle with a syringe filled with cohesive viscoelastic can potentially improve the safety and efficacy of the goniectomy procedure.